Looking at the breast to determine whether a woman is developing breast cancer is the #1 concern that every patient and every surgeon should have. The good news is women with breast implants do not get breast cancer any more often than women without breast cancer. In fact, studies show that women with breast implants get cancer a little less frequently than women with equivalent risk factors that don't have implants. And when women do develop breast cancer that have breast implants, the cancers are not any bigger, they're not any more spread, nor do they have any worse of a prognosis. So that's the good news. But you still need to be diligent about screening for early breast cancer. The first thing to do is breast self-exam. At the end of your period every month, and if you're in menopause, every month, the same time, you should continue to examine your breasts. And in fact, women that have breast implants often find it easier to feel for breast mass. I know a very good breast cancer surgeon, and she says she really likes breast implant patients because the implant pushes up on the breast tissue so that when you feel over the breast tissue, you have something smooth pushing it up so that it's easier to feel a little bit of an irregularity. So having the breast implant may make it easier for you and your doctor to feel for breast mass. So understand that breast self-exam is one of the most common ways that breast cancers are detected in women with breast implants. So it's important that you do your own self-exam and that your gynecologist and your plastic surgeon continue to do exams on you so if it ever, God forbid, happens, it's caught early. The next issue is the issue of breast screening. Based mostly on financial reasons, some of the federal recommendations for the frequency of mammograms have changed. I'm not a radiologist, but speaking to the radiologists in my community, they still suggest that a woman gets her first mammogram at age 35 and then annually starting at age 40, if that were normal. The real controversial thing, though, is what to do with MRI. In a separate video, we'll talk about using an MRI to screen for whether the implant is broken. But an MRI is also very important as a device to screen for breast cancer. Now, it's not the same MRI that's used for cancer that's used to tell if the implant is broken. Because when you look for a cancer, you have to get some dye in your IV, and it's a different computerized sequence, as they call it, of the MRI. So it's two separate studies, just so you know whether you're looking for a ruptured implant or you're looking for cancer. There is as yet no agreed upon consensus about whether and when and if to use MRIs to screen healthy asymptomatic women to detect an early breast cancer. But speaking to more and more doctors and looking at patients in my practice who happen to have had an MRI for one or more reasons, I'm aware of more and more cancers being detected early with MRI. It's my opinion that MRI, for anybody who could afford to pay for elective cosmetic surgery to start with, is something that you should discuss with your radiologist when you get a mammogram when you're over age 40. Certainly, if you have a family history of breast cancer, a lot of people today are recommending an MRI starting 10 years younger in age than was your relative that got that. In other words, if your relative got breast cancer at age 45, then starting at 35, you should consider getting an MRI. It's beyond my scope to give specific advice to anybody, but I want everybody to be aware that self-examination is very critical for breast implant patients. Mammograms should be started at 35 and more or less annually thereafter, and that MRI is something to discuss if you want to be sure that you're doing everything, if you have a family history of it, if there was any problem visualizing breast tissue with mammograms. But the good news after saying all of this is that if you are conscientious about doing your self-exam, and if you go to a mammogram center that's used to looking at women with breast implants, then you should have no fear, God forbid you develop breast cancer, that you might detect it any later than if you never had breast implants.